I'm just curious to ask you something that we talked before that I think was very interesting, your experience with the football players that you mentioned before, your neck and back. We were just talking about thoracic in these new ways of using thoracic and the importance of thoracic that sometimes we forget about. So do you want to talk about that example that you told me before about the back and neck pain of the football players?
So I'm in a bit, yeah, sure. So I'm in a bit of a unique situation in that so I've been very lucky. I'm starting to see, for the last 2 years, I've been seeing patients for the NFL. And these are the guys who are retired through UNC. They asked me if I would be the therapist for the program. I think there are like 4 centers around the country. And so the guys who are retiring or have retired have access to a whole barrage of medical help. And what they do is they'll fly these in UNC, where I'm working. It's called the Brain Body Program, and they bring in guys who have had like concussions and all sorts of other ailments or any ailments, and they're evaluated by psychotherapists, neuropsychologists, and I do the physical therapy part. And so they drop these guys in on us, and we've got 1 hour, literally an hour, to evaluate them from head to toe. And so normally the question is, it's exciting to do because these guys, nearly all of them, feel to a certain extent they have a level of disability from playing in the league. And of course, before they played in the league, they played at college. And a lot of these guys generated injuries in college, but because of the psychology of the sport, they just continued on. And they're such excellent athletes that they could play on with these things. And so a lot of the time, by the time they're coming to see me, they've manifested, they'll have like bilateral shoulder pain, bilateral ankle pain, knee pain, back pain, neck pain. But what I'm finding is a huge commonality with all of that is they have mid-back pain as well. And I mean, let me throw an example out to you. How many times have you seen a patient in the clinic that comes into you and they've got cervical pain and they've got lumbar pain? And the traditional question I would always ask before I started doing it this way was, well, what's bothering you the most? And they say cervical. So I'd start to reduce the cervical spine. And as we started to get better in the cervical spine, I'd start to look at the lumbar spine. And then what I'd find was that the cervical spine would start to get exacerbated again. And so I'd go back to the cervical spine, then the lumbar spine would start to get exacerbated again.